Good morning, Ayanda. Indeed, it's great to see the current confirmed cases continue to fall. The 7-day average currently sits at 930 cases on average per day over the last week. And while it's great to see this fall, it will be fantastic if this continues to decline. The lower we go, of course, the better it will be for us. With the recent easing of restriction and the increasing in the size of gatherings, as well as the current holiday period, as you say, there is a lag period, and we do have to wait at least 10 to 14 days to see if this has any effect on the numbers. Like you say also, we're currently seeing ongoing community transmission across all provinces with recent spikes in all of them. They are still fairly stable with the numbers low, but we can't let our guard down and can't afford to be complacent, especially over the current period.
Absolutely. Let's hone in on the trends in the provinces. Any particular areas of concern that you're noticing?
Well, currently they all seem to have stabilized. We've seen some slight spikes, a cluster outbreak in the Northern Cape 2 weeks ago, a recent spike in Eastern Cape. In fact, all of the provinces, Western Cape showed an increase last week. So did Gauteng, Free State and Mpumalanga on a slow increase. They're all still stable, though. I think the thing to point out, though, is that none of them are on a sustained decline anymore. We saw at least one or two were still on a decline a week ago, but they've all shown some transmission and some slight increase. No cause for concern just yet. I think they are stable, and the test positivity rates are also stable, nationally below 5%, which is good. However, a couple of provinces are, one is above the 10% mark and some headed for the 10% mark.
Yeah. I don't know, you'll correct me if I'm wrong, but this feels like one of the longest periods where we've had a sustained sense of stability insofar as our COVID-19 infections, especially given that we've also been on level 1 of the lockdown for quite some time. Are you getting a sense that we're getting better at these non-pharmaceutical interventions?
Look, we were on a similar plateau and trough between the first and second waves, albeit at a slightly higher level. We're currently at a lower base now, which is good. I think we're still emerging from the second wave. Looking at the data over the past year, what we saw is between the first and second waves, about a 2 to 3 month period of this plateauing and flatlining. So I think we're still within that period, and we do need to monitor for any possible outbreaks. And given the track record over the last year and the upcoming winter period, it's expected possibly to see some rise in May, June. And hopefully this won't be triggered by current gatherings or any complacency. So we just need to monitor for that.
Dr. Suliman, I wonder if we can speak about the death toll with a bit more detail now. The sense I've been getting, and you've been watching the numbers much closer than I have, I'll say that up front, is that the deaths have still remained relatively stubbornly high. I mean, even at times where we have really low infections, sometimes the death toll can be quite worrisome. Is that what you're also picking up? And what possibly can we attribute this to? And I ask this knowing very well you're not a virologist yourself, but from your reading, I mean, are there any things that we can deduce from the death toll?
So currently we are averaging about 45 new deaths on average per day across the country. This has been on a sustained decline. It's shown a decrease of over 40% week on week. We do need to bear in mind that there is a lag period between reported deaths and confirmed cases. We need to wait at least 2 to 5 weeks to see the same trend in the deaths as reported in cases and test positivity rate. So what we are seeing now is still a good decline in the number of reported deaths, and it's following the trend that we see in cases. What we also need to bear in mind is that it does take time for deaths to be reported, and it's not necessarily reported immediately, and so there sometimes is an additional lag in terms of the reporting. If you follow the excess death trends as well, we'll notice that the number of deaths are on a decline. line still.
Yeah, I'm sure you're watching the trends even beyond our borders. Just these past few days, I think it was France and Italy had just reimposed their lockdowns, and this is because of their third wave, which is now fully fledged in that community. Those are possibly early warning signs about what's to come here in South Africa.
Indeed, we are seeing continental Europe see another surge, their third wave, and as you say, restrictions across many of those countries. And as we have seen over the past year, our trends have seemed to follow those from continental Europe. And so this is a warning sign. We are monitoring that, and hopefully we won't see the same. Unfortunately, it is possible and quite likely that we will see that in the upcoming winter period. So hopefully we can learn something and try to remain vigilant, especially as we move into the winter months.
Yeah, and one of those lessons possibly, Doc, is that even if you have a fully fledged vaccination rollout actually being implemented, that doesn't necessarily stave off the virus from being transmitted and that having a cascading effect.
Indeed, one thing we don't know is the effect it has on transmission rates. Also, we do need to bear in mind that we need to really wait a while before we vaccinate a sufficient proportion of the population before vaccinations will have any effect on the numbers. So right now we've vaccinated just about 270,000 healthcare workers, which is part of the research implementation study, which is formed part of phase 1 rollout. But as a total proportion of the population, it's less than 0.5%. So the vaccinations will not have any influence on the transmission numbers as well as the hospitalizations and deaths, at least over the winter period and probably for the remainder of the year. So while it still remains another important tool in combating the pandemic, we need to continue with that. It's not going to have any effect for the remainder of the year. So the focus still needs to be, as it has been for the past year, on reducing transmission and reducing the opportunities for the virus to spread. So focusing on reducing super spreading events and minimizing cluster outbreaks.
Dr. Ridwhaan Suliman, always great getting your insights on these trends. Thanks very much indeed for making time for us this